It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming for today's briefing from the South Korean health authorities. We'll be getting the latest numbers and analysis on the local outbreak, as well as updates on the government's measures and policies to stop the virus. Let's listen in.
We will hear the presentation from Mr. Son Young-nae. It is January 17th, and I will start the COVID-19 briefing. As of midnight of today, there were 500 newly confirmed cases in Korea. And yesterday, there were 125 confirmed through the preliminary testing. 13 people passed away yesterday. We pay our respect to the deceased and we pay our condolences to the family members as well. With regards to disease control, now I will present the findings. Yesterday, due to the weekend, there were 50,000 tests carried out. Across the country, in screening centers, 29,000 people were tested, and around 19,000 people were tested in preliminary testing centers. If you are suspicious of your health condition, even for a little, please make sure to get tested, and we want to ask you to do so. And for the medical practitioners, we actually have enough room in our system. And right now, the waiting time and the waiting people are actually amounted to 0 per day for 2 days in a week. And right now, we have enough hospital beds secured, and we have around 76 secured across the country. And we actually have more than 125 in the metropolitan areas as well. And we also have dedicated hospitals and living treatment centers. And if we were to combine all of that, then we actually have more than 15,000 hospital beds available. And for the number of personnel as well, including doctors and nurses, we have actually more than 2,000 people being dispatched, and they are supporting us in many areas such as living treatment centers. And for living treatment centers, there were the military school nurses who were helping out. And 77 people have actually completed their position for a month. And we want to ask all of the students who have helped out despite your busy schedule in your studies as well. And also, we also want to thank the military and the nursing school for supporting us throughout COVID-19. Now I'll explain to you about the trend for last week. From January 10th to January 16th, on a daily average, there were 560 newly confirmed cases per day. And compared to more than 700 in the previous week, we are seeing a decrease. And in the regional areas as well, it has gone from 521 to around 341 in the metropolitan area. And the number has also decreased in non-metropolitan areas as well. And also for the reproduction rate, it is less than 1. And we are seeing that the positive rates are going down. The number of cluster outbreak is also being decreased. And as of now, the spread of the infection is mainly happening from religious areas or through family members from small gatherings. And right now, infection from contact is still high at 45%, so we can see that these infections are spreading mostly through personal contact. Right now, the third wave of infection is facing a decrease, and especially we see the risk for multi-use facilities decreasing. However, right now, the number is still quite high, and we should not be relieved right now. When we see the trend for now, we are seeing mostly small cluster outbreaks spreading through nursing homes and long-term care facilities and other small gatherings. And also, it is happening through personal contacts such as family members. When we consider all of these factors, we want to refrain from having any gatherings or having any meals together, and we want to ask you to refrain from being in contact with others. And also for religious activities such as churches and also for long-term care facilities, we want to ask you to be especially careful. If we were to continue the current trend right now, we have to make sure that we decrease the number for us to be able to relieve our social distancing measures. So we want to ask you to take care, and we want to ask all of our citizens to cooperate so that our businesses can go back to normal operation. Starting tomorrow, some parts of distancing will be changed, especially if there were many businesses that could not operate, and we're going to resume operations for some of them. Right now, we cannot be relieved right now, and the spread and the wave could resurge at any time. For multi-use facilities, we have to make sure that we don't see cluster outbreak in order for us to be able to open up more businesses. For the operations and businesses that are resuming operation, please consider all of this, and please make sure to have thorough disease control. For indoor sports facilities, in January, when third wave came up, we want to ask you to be especially careful because the third wave started from the indoor sports facilities in November. So we want to ask you to make sure that you only use a limited number of entrance doors, and all users have to make sure to wear face masks inside, and you cannot have anything to eat inside. And please make sure to have a certain amount of distance maintained between people, and please make sure to have a 2-meter distance, especially in areas where you could have saliva being passed on. And we also are disabling any entrance of 5 or more people together, especially for screen golf centers. When you have rooms there, please make sure to be especially cautious. And for the facilities, if it is closed, and if there are many commonly used equipment, please make sure to ventilate a lot, and please make sure to be especially careful once again. For religious facilities that are enabling face-to-face services, we ask you to be especially careful also as well. So there were religious facilities where infection spread through cluster outbreak. So rather than having regular services, please make sure to be especially cautious, and please make sure to refrain from having small gatherings such as Bible studies and so forth, because those were especially risky in terms of the third wave. And there could also be infection spreading when people are shouting or chanting and singing. Therefore, we are going to make sure that the choir will not be sitting in services, because that could lead to the passing on of saliva. And we are also prohibiting any biblical studies from happening as well. And for the praying centers, people will not be able to sleep overnight, and people will not be able to have meals there either. So we want to ask you once again to adhere to all the rules, and please make sure to make the effort. If we can decrease the risk, we will be able to guarantee a wider variety of religious activities. So we want to ask you to cooperate so that could be so in the end. Until now, many religious facilities cooperated with us until now in order to refrain and contain COVID-19, and we want to thank you for that. So we want to ask all of those in the religious areas to be especially careful and to make sure to follow thorough disease control. Right now, third wave of COVID-19 is being mitigated, and we believe that if we make efforts for just a little more, we'll be able to overcome this. With the winter time, a lot of the countries had to go through a lockdown. However, we are still facing the resurgence of COVID-19. Right now in Korea, we did not go into the third level of social distancing, which could have affected the businesses of many of the lay people in Korea, and we were able to make good achievements without going into level 3, and this was thanks to the efforts of our citizens. So we want to express our gratitude to all of you. It might be difficult for you, but we just want to ask you to make a little more effort. And once we do, with the spring coming up, we'll be able to make use of the treatments and vaccines, and we believe that we'll be able to actually contain COVID-19 while going back to our normal situations. The government will also strive hard. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
With the third wave of COVID-19 infections, South Korea has been on edge trying to keep the hospital bed occupancy rate under control. Securing enough hospital beds for severely ill patients has been one of the most important tests for managing the pandemic. A research team at the Korea Advanced